delay. Hello.
How's everyone?
Everyone's good. Ramadan Kareem. Oh, he's coming. He's coming. I'm so excited. I can't wait. Okay, what are we going to talk about? I love you, Mahari. Habibati, brush your teeth. Okay, what are we going to talk about today?
Kids myth.
Yes. Myths, yay or nay? Hi. And of course, we're here for you, and we're here for you to ask us your questions. That's why we're here. And she's an amazing pediatrician, Dr. Rita.
Thank you.
And, as dentists, we will both serve and answer your questions. And if you ask us live questions, you know what? We're going to answer them. We know we will. We promise. What is our first myth of the day, Doc?
So, myth number 1. Chewing gum works like brushing.
Doesn't it?
Yes, why not? Because I will take the chewing gum, I will brush my teeth at the same time with my saliva. What do you think?
It's the best fact ever. You know what? I never tried it. Let me do it. Who needs a brush if you can brush with gum?
Exactly. What?
And unfortunately, it's a myth.
Oh.
Can you hear me still? Because someone is calling me and the audio might be restarted. If you can't hear me, give me a thumbs up. If you can't, then give me thumbs down. Then I'll know. Thumbs down if you can't hear me. Okay, so yes, gum on the teeth is amazing after food, especially sugar-free gum. We're not talking about sugar gum at all. But is it an alternative to brushing? What do you think?
No.
It's a myth. We don't do that. We need the normal brush.
It's your turn now.
It's my turn? Okay,
Yes.
So how about fever?
Yeah.
Fever and seizures.
Yes.
Is
Everybody can have seizure because of the fever.
it true?
No. Only 4% of children can have.
4. It's only 4%.
4% of children can have seizure because of the fever, but still not the high fever it will cause the seizure.
Yeah.
It's the quickly dropping or quickly getting up the fever can cause seizure. So that's why the parents will notice the fever after the seizure. So not every fever can trigger a seizure.
Good. And it's good for us to know that. And so, but of course, what is the advice for fever?
So we can give fever reducer, but sometimes also we have to see the child. If the child is okay, active, playful, there's no need to rush and have a fever phobia. So we can keep the child
fever
playing.
phobia,
Yes, we have fever
phobia.
phobia. It's true. So we can treat it with some fever reducer.
Good. I love that. Wait. I have one more about cheese. Do you know something about cheese and teeth?
Cheese and teeth?
Mm-hmm.
No.
Cheese and teeth. So some people would think if you eat cheese, after something, it can make your teeth go bad.
Really?
What is that?
I don't think so. Cheese, they have calcium, right? So
Exactly.
they are good for teeth.
It makes the saliva more.
Okay.
It makes the saliva more, so the cheese affects the saliva, so the saliva affects the teeth and cleans the teeth, so the teeth are healthier.
Wow.
So eating cheese after sweets is good, not bad.
Very nice. I will keep this in mind.
You keep that in mind. Okay. You have a question?
Yes,
Should I
have.
ask you? I'll ask you. Wait.
Now.
Fever.
It's my turn. now.
Okay. You tell me.
Does teething cause fever?
Yes. No, it's not true. It actually gets, what's the word? Incriminated. It gets blamed.
It's a coincidence.
Yes, exactly. It's a coincidence. And I always say, look, it happened at the same time. There's something going on. And that is why if a child is teething and has fever, what should they do? Ignore?
No, they have to be checked by a doctor.
Both of us. You have to see us both. Again, that's when
because at that age, between the age of 6 months, 8 months, and 10 months, whenever we have the teething period, it's more prone to have infection as well.
Exactly.
So that's why it can be coincidence.
Yeah,
that
tummy.
it can be linked to that reason. And then also that some people think that teething can cause diarrhea. So what do you think about that?
Yes, good question. You know what? I had a patient who had fever, who had diarrhea, and didn't come because thought it's teething. And when she came a week later, the child was already lost 3 kilos.
Wow.
It's a lot, and I think you saw her too.
Really?
Yeah.
I guess.
Yeah. I saw her, and then I'm like, oh, it's not
eating.
She has to see you. And then you did your thing. You supported her, and then the child, we saw her later. She's fine. And by the way, the patient that just cried out and made me a little bit late, she is our co-patient. I saw her 1 week ago, and she had infection, and they thought it's the teeth, and the teeth had nothing to do with it.
Yes, I remember her.
Right? Teeth had nothing to do with it. I said, no, the teeth have nothing to do with it. You have to see a pediatrician. And then she saw you, and then now she's better.
Thank you.
I love that.
But I guess the teeth will cause fever whenever they have abscess or severe infection, right?
Yes, absolutely. Yes, that's when teeth come into play, but not for babies. Not for babies.
Exactly.
Yeah.
Yes.
Not for babies.
So now it's your turn to ask me.
Okay, I'll ask you also about fever, because fever phobia is real. If the fever is high, myth or fact, it's serious.
You mean the cause that's serious?
Yes.
Okay, if the fever is high, it can be and cannot be serious. So the exact number of the temperature is not linked to the severity of the illness.
Good.
So what we have to look is the child. How is the child? If the child is having low-grade fever but he looks very sick, it's gonna worry. I will be worried more than a child with high-grade fever of 40, but he's active and playful. So it's not the exact number of the temperature that is worrisome. It's how the child is.
Latifah House, hi. Okay, so this is quite reassuring. Actually, you're quite right. We have to look at the boy or the girl and how they are behaving too. Because what does fever mean? When someone has fever, what
fever
does it mean?
Fever is a good sign. Fever, it means that our immune system is fighting that infection. And this is what, because these immune cells, they are working and can destroy and kill this virus or bacteria on this temperature. On this body temperature. So having fever is a good sign. But how the child is more prone to have a serious illness or not. Good.
I love this. It's so important to determine the facts against the myths from fever.
Yeah.
Because fever phobia is real. السلام عليكم دكتورة سامة. We love you. كل سنة وحضرتك طيب. بيقولوا ايه؟ بيقولوا ايه؟
اسأليني انا.
ايوه بيقولوا كلام جميل حلو قوي. كل سنه وانت طيب، عيدك مبارك. تنعاد عليك الايام الجميله بخير وصحه وسلامه. Love you.
So now I have myth number 3.
Okay,
right?
for me.
Yes.
Okay, I get it.
Does flossing cause separating of the teeth?
Of course it does. No, I'm just kidding. No, it doesn't do actually. Yes, thank you. Hey, Dr. Elna, good afternoon, Doctor. Nice to see you. Hey, Dr. Mooney. So, yes, this is such a common myth that people think flossing can cause spaces. But what causes spaces, you know what causes spaces? You remember the toothpicks from before?
Yeah.
The wooden ones and the big thick ones. If you keep poking the gum, that creates a space because the gum gets eaten away and then it creates a space. So actually toothpicks are the ones that create that, not flossing. Flossing is the best, and how you do flossing is really helping in you achieving health. Like, you don't just snap it right in the center, you take it to one side, because snapping in the center will mean you are messing up with the gum that's in the center. You need to take it to one side and out, and then another side and out. You're like, you don't snap. You don't do that. Like, imagine you're doing this to your skin. Your skin's gonna hurt. We don't do that to our gums, but it does not create spaces. Okay. Yay, I love you.
Thank you.
Okay, so myth number, you keep counting the myth.
Yes, it's your turn now.
So now, what do you think if the child talks early? Does it mean they're a genius? Is that myth or fact?
Yes and no. In fact, yes, early talkers, they are having better skills in language, grammar, and vocabulary.
Nice.
But doesn't mean they will be more intelligent than the others.
Okay.
So they will have better skills in all what is grammar and vocabulary, but not having better IQ than the late talkers.
Right. So they will get better skills because they were exposed early?
Because yes, they will have more in rich vocabulary than the late talkers.
Nice.
Yeah.
but it
But that doesn't mean that I'm having a better IQ.
Yes. Okay. Cool. I like. Okay.
So now it's my turn. Bleeding gums are normal.
Of course they are. No, I'm just kidding. That is a myth. Bleeding gums are not normal, you guys. Bleeding gums means that the bacteria is right under the gums. Do we want bacteria in the mouth?
No.
Nuh-uh. And the bacteria loves our mouth, just FYI. And if it's there, it means the gums are not healthy. Bleeding's there. Gums are not healthy. You need to come to a dentist for them to brush, and then you go ahead and brush. And sometimes it just means food is stuck. When you do it with floss, you know, if you're flossing regularly, your gums are not supposed to bleed.
Okay.
Right? So that is definitely a myth. Bleeding gums are not okay. The fact is, you can live without bleeding gums when you clean them.
Okay.
Bleeding gums is not a good sign.
Very nice.
I like it. Yeah. Your questions are awesome. Okay.
Now it's your turn.
Okay, so good question. I love this question. If you talk to a child in one language, do they grasp it easier, quicker? Myth or fact?
Myth. Because
Myth.
the child, we can have like talking two different languages with the child, and he will be able to capture it. So, having different languages is not a reason for a speech delay.
Right.
Okay, so if a child is having a speech delay or a language problem,
yes,
he will have it in both languages.
صح.
But bilingual children, they tend to have more grammar errors because they will be confused, because you know each language they're having each like different grammar, so they can have grammar confusion. Yes, but it's not a reason for a speech delay. So whenever we have a speech delay, we shouldn't say because of the type, because we are talking different language with the child. It's not that. We have to find out other things.
Good. So it means, for example, I'm speaking English to the child and you're speaking Arabic. The child can still
understand.
You know,
he can mix. He can mix some words from each, but still he can have normal language. And
I see that, you know, the other day I had a child whose mother is Japanese and whose father is local. So like, very far languages, you know. Sometimes I see an Italian parent and a Spanish parent, and they're both, it's kind of similar.
Yeah.
And then the child speaks English, so there's 3 languages in the mix. But when it's like Arabic and, you know, Japanese or Asian or Chinese, it's so different, so different, and even the so different, you know. But you're saying that this is okay.
Yeah,
it is.
And
kids can get
last
it.
time we were like speaking with the patient. She's French, the mom. The father is Kurdish Arabic. Kurdish Arabic.
So there are 2 languages right there.
The father is speaking Kurdish Arabic, mother French, and the father and the mother, they are speaking together English. So the child is speaking like more 3 languages. With his grandma, he's speaking Kurdish. The father is Arabic. The mom speaking French. And whenever everybody English. And he's so small. Like I feel like I guess he's like 2 years old. He's so cute.
Oh, they're so amazing. They understand.
Yeah.
You know, subhanAllah, they understand when you call them. They understand their name. And when you're like, eat or do this, they understand. It's interesting. It's very interesting, the science of developing languages. You know what? A little bit before, you know, myths, we go into the myths. Baby science. So apparently, if a mother is reading to the baby still in utero, the baby still being baked in the oven, it makes the baby have more language skills later when they're born. Baby science.
Wow.
Yeah. And of course, even now the baby's born, let's say 6 months of age, and you're reading to a baby 6 months of age, nothing.
That's why we are saying to parents, we have to talk to the toddlers, even like if we think that you will not understand, we have to talk and to repeat.
I am doing your diaper, poo there. I'm doing your diaper, and you just do. You know, now I'm feeding you because you're so cute. Now I'm just gonna do your doo-doo, bye, you know, and you're just talking whatever you're doing. And it's a baby, it's a tiny baby. But again, this leads to more brain development in the language center.
Yes.
It's amazing. It's amazing.
So, It's my turn now.
It's your turn.
So it's the last myth, right?
It's the last myth.
Yeah.
It's the last myth for the day.
So I have the last one.
What was it?
Cleaning harder, like it will makes my brushing harder cleans better.
Of course. No, I'm just messing with you. You're so nice. You clean harder. Okay, I can see you. Okay, myth. You tell us, myth or fact? Myth or fact? Clean harder. You get better teeth, right?
Yes, it's gonna be like more clean as well.
Yeah, more whitened. I wish that. More bleeding and more bad gums. You know what? Yes, that's a good question. It is a myth that the harder you brush, the better your teeth be. Opposite. The harder you brush, I love. The more we brush like this, then we injure all these areas, and especially when we put pressure, and then the teeth are not just, they're getting cleaner, you're actually exposing what's inside. That's why they look whiter. But that's not true, right? And that is why, most of, the new brushes now
are soft.
Yeah, and not just that, they have a pressure sensor. Because sometimes you use a soft brush, but remember, you are brushing, you're not thinking of brushing, you're thinking, oh my god, what am I going to eat? I have this, I'm late, oh my god, it's the morning, it's the night, I want to sleep, I want to do this, blah, 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 blah. So all this is going through your head, so you're like, blah, blah, blah. And our hands are really strong. Our right hand is really strong. Whoever's right-handed or left-handed, their main hand is strong. So you are injuring yourself. And that is why these pressure sensors in an electric brush are so important. Whenever you buy a brush electric, you buy it with a sensor. I've known people who they have great teeth, they damage their teeth just from brushing. One time, before I became a pediatric dentist, I don't forget this man. He was a nice, big Sudanese man. And he had a nice brush, and all his teeth, I'm not kidding you, all his teeth in this area was eaten up. I did close to like 24 fillings. 24.
Wow.
On this area. Because he had so much pain at the end. Because he was brushing so hard that he removed or stripped the first layer of every single tooth. Until I switched his tooth. And I did the fillings, and oh my god, he was so happy. Next time he went on a trip, he got me all these nice African, because he was just so grateful that he does not have pain anymore. Love your question. You're the best, Joe.
Thank you.
You're the best. We need to do this more often. Guys, you suggest to us, what should we be talking about? What do you think we should be talking about next time?
Next time. What? With the pediatrician, nutritionist? What?
Me and you.
So we can repeat this.
Okay.
We can.
Yeah. If you ask us more questions about myths versus realities or facts, we are going to answer them for you. Is it time to wrap it up?
Yeah.
Miss you guys. Eidkum Mubarak. We love you. Hi, Prince Hawashi. Oh, Prince Shy. Shout out, Shy. We love you. Okay, so we love you. Gotta go. Patients waiting. Have a brilliant Eid. Tell us all what you're going to be doing. Eid, don't eat too much Eid cookies. I love Eid cookies. They're the best.
Yeah.
They're the best. Okay?
I'm gonna brush my teeth after that.
Yes, you do that too. Me too. I mean, I'm gonna eat more than cookies, but off camera, I'm not gonna tell anybody. No, I'm not. Yalla, يوم سعيد. مع السلامة. Bye. Love you. Love you, Shy.